This is Where We Live from Connecticut Public Radio. I'm Catherine Shin. Families from across Connecticut, the nation, and the world are watching to see what's next in Iran following the killing of Supreme Leader Ayatollah Ali Khamenei. Iranian state media reported his death early Sunday after a major attack launched by Israel and the United States. We wanted to open today's show with some perspective on what's been happening in Iran and the broader implications for the Middle East. Joining us now is Farhan Memon, the board chair for the Connecticut Council on American Islamic Relations. Farhan, welcome to Where We Live, and thanks for being here today.
Thank you for having me. Good morning.
Good morning, and I wanted to start, if I may, by asking you your reaction when you saw news of the strikes by the U.S. and Israel on Iran over the weekend.
Well, I would start with saying that we have to acknowledge that the Iranian government has a terrible human rights record. But at the same time, we have to be consistent in our desire to protect civilian populations and follow international law. So my first reaction was that we've been dragged into a war that wasn't necessary. The Israeli government has been trying to convince successive United States presidents to attack Iran, and Donald Trump was the only one foolish enough to agree.
Well, your organization is calling on the state's congressional delegation to oppose the war against Iran. I know you touched on it just now, really, but can you expand more and tell us more about why?
Well, under Article 1 of the United States Constitution, it's Congress that has the power to declare war. And unless Congress declares war, these wars are illegal, not only by international law, but by our own laws. And Congress, unfortunately, over the years, over successive decades, has really ceded its authority to the presidents of the United States, to the executive, and it needs to take that authority back. So this week, there's a war powers resolution that's being voted on. And we really want to ensure that our congressional delegation, the 5 congressmen and women and the 2 senators, vote in favor of that resolution so that Congress's power to declare war is supreme.
So the tension, there's a lot of history between the countries over the years. What do you see in particular as the cost of this war, both abroad and here at home in the U.S. and Connecticut?
Well, the cost, first and foremost, is one of lives. Innocent civilians in Iran are dying. We know, first and foremost, that 185 schoolgirls were killed as a result of bombs being dropped. Now, I don't know whether they're American bombs or American-made Israeli bombs, but if 185 schoolgirls died in Israel or in the United States, that would be the end of the story, right? I mean, we would nuke the country that did that, literally. And so lives are the first casualty, not only Iranian lives, but also American lives. We've lost at least 6 servicemen and women so far. Who knows how many more have died? I'm sure there are countless Israelis that have died, but we don't know because Israel has a strict military censor. Secondly, the economic cost. We were told by this president that he wouldn't get us into any more endless Middle East wars that cost trillions and trillions of dollars. We have very serious issues at home, ranging from education to healthcare and overall affordability. What's going to happen to the price of gas as this war continues? On all fronts, this was a very, very bad decision.
When Iranian Americans here in Connecticut are also reacting to U.S. strikes with mixed emotions, some, like Hossein Kamali in Hartford, are critical of the Iranian regime but don't think war is the answer. So here's what he told our colleague, Connecticut Public's Eddie Martinez.
War is traumatizing, and it is impossible for me personally not to sympathize with civilians getting hurt first and foremost.
And other Iranian Americans in Connecticut, like Ramin Ahmadi, says the attacks are necessary to defeat an authoritarian regime.
We are excited that the leader of this criminal regime was killed.
And so, Farhan, we just heard from 2 voices, and there are only 2 voices of many, and the attacks are being met with a wide variety of reactions, both at home and abroad. What goes through your mind when you listen to those clips?
Well, I'm not Iranian, and I do think that we do have to acknowledge the lived experience of Iranians both in Iran and in the diaspora. They have endured over the last 40 years a really brutal government. And so, of course, if you throw a drowning man a life preserver, they're going to cling on to it. But assassinating foreign leaders, bombing their countries indiscriminately, targeting their civilian populations is not the answer. We've seen this time and time again, especially in the Middle East. We think it turns out, well, in the sense that, the statues come down, there is cheering in the street, but it quickly turns into something that's a disaster. And so I agree with Dr. Kamali that the civilians are going to be the ones that suffer. I understand the second speaker's sentiment in the sense that someone who he considers to have been a brutal dictator killed thousands of protesters, most recently because of his government's policy, is gone. But at the same time, this type of measure brings more and more suffering to the people, not less.
When Khamenei spent more than 3 decades in power, he was known internationally for brutally crushing dissent and also for an ongoing hostility relationship to the U.S. and Israel. And President Donald Trump called him one of the most evil people in history when he announced his death on social media. So how do you respond to those comments from the president?
All of those things are true. But, Donald Trump is no saint himself, right? Certainly maybe not on the scale of killing, millions of people or having them suffer under his government. But, there are human rights abuses that the American government has done. And certainly, Trump with his various immigration policies and so on and so forth that he's responsible for as well. Every life counts. But again, we've been told that we live in a rules-based world order, that there is such a thing as international law. But the United States, and Donald Trump in particular, and Israel have no respect for that rules-based order. I think the Canadian Prime Minister said a few weeks ago in Davos that it's just a mirage, good for certain countries, particularly those in the West, but doesn't really apply to the rest of the world. And I think Donald Trump is proving that true again.
And I know you'll be following this closely, just like we'll be following this very closely. What are you looking for next? Any thoughts about what's next for Iran in the region?
Well, unfortunately, I think it's going to get worse before it gets better. I think now that the United States and Israel have attacked Iran, from my reading of the situation, Iran needs to prove that it can't really be cowed into defeat. So I think that they're going to continue to defend themselves as best they can, the regime, and also then, send missiles into Israel, to other countries that house U.S. military bases, and they will try to create a war where, the United States and Israel run out of interceptor missiles before they run out of missiles. It's going to be a lot more war that's going to happen before people realize that they have to come to the peace table.
You've been listening to Farhan Memon, who is the chair of the Council of American Islamic Relations in Connecticut. Thank you so much for spending time with us today.
Thank you for having me.
And we will be returning to this conversation as we follow the news. And we also want to get some perspective on the potential humanitarian impacts of the ongoing conflicts in the Middle East. Joining us now is Pravash Budden. He's AmeriCare's Deputy Senior Vice President of Emergency Programs, and AmeriCare's is based in Stanford. Pravash, welcome back to the show.
Thank you very much, Catherine. Good to be with you.
And so I know you, of course, have been following the conflict in Iran, which is spilling over to other parts of the Middle East as well. Israel is launching attacks in response to strikes by Hezbollah, and Tehran is keeping up missiles and drone attacks on the Gulf states that host U.S. military bases. And so your group has been monitoring the developments in the Middle East. So broadly speaking, what are some of the humanitarian needs over there that that's probably going to be needed soon?
Well, as you and your listeners know, the Middle East has for decades been a hotbed of conflict and disruption to people's lives. It seems like every year there's a new flavor. And right now we're looking at what's taking place in Iran, and Farhan has laid out very well the situation. But I'd like to just step back and apply some of that same concern across the region. As a health organization, we really are concerned about the state of health access and health care for millions of people throughout the region. And conservative estimates are that between 30 to 35 million people across the Middle East in fragile contexts such as Lebanon, Gaza, the West Bank, Syria, Iran, Iraq, and all the way to Afghanistan face significant barriers to health access. So hospitals, health centers have been damaged through years of conflict and war. They've been closed down or they don't have enough staff to operate services. Supply chains for medicines and medical supplies have also been disrupted. Power and safe water are limited, and there is limited access, safe access for patients to healthcare providers. So not only do people need healthcare for immediate trauma in the heightened state of conflict, like we're seeing in Iran, but that we've seen for now years in Gaza, in southern Lebanon, in Syria. They also need steady services for primary care, including access to medicines for chronic diseases such as diabetes, hypertension, heart conditions, and cancer. Some of your listeners may be familiar with the rising death toll in Gaza during 2003 up until the end of last year when a ceasefire was arranged. And there were number counts around 60,000 people dead, but that wasn't accounting for the longer lasting deaths occurring from preventable diseases and access to healthcare. So those numbers aren't out yet, but again, those just grow and grow as conflict continues throughout the region. And apart from the physical care that's required, is also mental health. And we know from experience in America is that conflict, displacement, and uncertainty puts a great amount of strain on mental health, and that can have generational effects. So each of these contexts throughout the Middle East have unique drivers, but it's really the conflict, economic collapse, displaced populations, systemic underfunding is what we've seen just in the past year with the withdrawal of foreign aid from the United States, as well as other nations, as well as political restrictions are really core ingredients undermining health access across all of these settings and leaving millions without reliable, affordable, or safe healthcare.
And I think when we think about humanitarian aid, oftentimes we think about specific needs like food, water, and you mentioned a lot of medical supplies and whatnot. And I feel like, especially conversations that you have had with us here on Where We Live over the last couple of years, mental health has been a big focus for many, not only for those on the ground, but also the humanitarian aid workers who are on the ground helping, whoever they're helping in those moments. So are you able to give more aid, not just to those in countries that need the aid, but also for your workers as well in terms of mental health?
Yes, for years now, AmeriCares has been focusing on mental health support services to frontline healthcare workers. And, over 2004 and 2005, the Middle East saw significant numbers of aid workers and specifically healthcare workers lose their lives, hundreds of them, and specifically in Gaza. And the amount of trauma and stress that doctors and nurses and pharmacists and logisticians go through to provide critical care to populations in crisis puts a strain on them because they are not only providing those services, but they and their families are going through a crisis of trying to figure out where their next meal is going to come from, if their homes are safe, if they need to move somewhere, and if their families are in danger. And so we feel that we have an obligation as a health organization to provide mental health services for the people who do and provide health services across the region and across the globe, as well as extended services to populations that have suffered from increasing amounts of trauma, that are displaced, lost family members, and just with a huge amount of uncertainty in their lives. For example, in Syria and in Gaza, we work very closely with our partners and frontline healthcare workers to provide mental health services. And then we continue providing the wraparound services of medicine and medical supplies, medical mobile units as well for longer term care. And I'm afraid that with the current situation in Iran, we're just going to be seeing more of this. Again, even airstrikes from Iran have reached Jordan and Syria and the western part of the Middle East. And this is very disruptive, not only to public services, but for healthcare and health access in many of these places.
Well, and as you watch this unfold, and I know you mentioned that you already have workers around the region sort of taking care of what's been going on there, are you prepared to bring workers into Iran the moment you can?
Well, we're monitoring the situation in Iran. It's absolutely challenging to work in Iran for U.S. organizations. There are a significant amount of restrictions to be able to operate in Iran, but we want to make sure that we're elevating the needs for healthcare in Iran as they develop. But, across the region, it's just challenging to do this work. In any active conflict zone, the needs are immense, but you have to deal with checkpoints, border closures, damaged infrastructure, rules and regulations, state and non-state actors as well to negotiate access through. But delivering aid is it's not just about shipping the supplies, it's also about matching the right resources to the right communities at the right time and coordinating with local partners and adapting to fast changing conditions on the ground. So our eyes are peeled and we're going to be looking into what more we can do and have value add as AmeriCares for health needs across the region.
And joining us now on the phone is Yanti Suripto. Yanti is the U.S. President and CEO of Save the Children, which is based here in Connecticut. Yanti, thank you so much for joining us today.
Thanks for having me, Catherine.
And so, Yanti, of course, you've been following this as well. What is the latest that your organization is hearing in the region?
Well, sadly, as always, Catherine, children are paying the price of any conflict, and this is no exception, right? We're now seeing, I'm just hearing from my colleagues in Lebanon, where I think over 30,000 and probably more people are displaced. Our teams in Lebanon are responding. We see children in shelters, schools are closed. Again, in Gaza, humanitarian access has been closed off. So again, fewer supplies are coming in. And we'll see the impact on children from Iraq to Syria to Israel to Lebanon and Gaza and the West Bank again in this region. So we're incredibly concerned. As we know, children are uniquely sensitive and vulnerable in cases like this of conflict. Not only in the immediate instance, of course, injuries hit them harder and more severely. Loss of school and the trauma attached to displacement and loss of people they know, their immediate family, etc. But also really the long-term impact, what the previous caller, my colleague, just discussed around mental health and the need for psychosocial support going forward. Children, these wars and conflicts really leave long-lasting scars.
Well, of course, you have a focus on children, and we'd love for you to talk a bit more about the importance of protecting children and civilian infrastructure in the country, because Iran is demanding international action after attacks, it says, have impacted hospitals and schools. Missiles reportedly destroyed a girls' primary school in the country, killing more than 150 people, according to Iranian officials. So how do you protect children in situations like that, where there's so much that's out of your control?
Right, and look, what we do is calling out for all parties to cessation of hostilities is first and foremost the most important thing. But even in the case of hostilities, there are rules to conflicts like this. Hospitals, health clinics, schools should never be. Everything must be done to protect them from being targeted or hit. And clearly, we're seeing that is not the case here. Immediately, we saw the school being hit in Iran. We're worried about health infrastructure across the region, and we've seen this before. We've also seen it in Gaza. We've seen it before in Syria. So again, if actors do not adhere to their to essentially international law, that is problematic, and it shapes a precedent for every other conflict that might ensue afterwards if people are just getting away with it.
Now, last question here for you before we go to break. President Trump has said that the strikes on Iran could last for weeks, but the timeline remains unclear. So when you look at the situation unfolding in Iran, I know you kind of mentioned, both you and Pravash had mentioned this actually, to talk about, what do you see as some of the short-term and long-term challenges for kids?
Right. So we see the immediate impact of displacement in particular, but also of potentially lack of access to healthcare, to nutrition, and the closure of schools, or at least the suspension of schools, and the immediate sort of traumatic impact on kids losing family members or friends, and their long-term impact of that as well. We've done. We've worked on conflict for over 100 years. When we looked at this, particularly in a conflict like Syria, which of course was going on for a long, long time, there was huge traumatic impact on kids after sort of 8 to 10 years of that war. That is significantly impacting their ability to live healthy, productive lives, learn, even if schools are reopened, to effectively learn. And sort of emotionally, socially grow. So we're incredibly concerned about that. So we're responding in the countries where we can, where we have child-friendly spaces. We provide immediate emergency supplies where required. And of course, we're trying to make sure that children who have lost parents or immediate family are protected. So that is going to be our focus for the next sort of the immediate period. But again, the longer-term impact is also something we're preparing for.
That was Yanti Suripto. Yanti is the president and CEO of Save the Children, based here in Connecticut. Thank you so much, Yanti, for taking the time and talking with us today.
Thanks, Catherine.
And also with us was Pravash Bidden. He's the AmeriCare's Deputy Senior Vice President of Emergency Programs, and AmeriCare's is based in Stanford. Pravash, appreciate your time as well.
Thank you so much.
And coming up, we're going to pivot away from Iran and take a look into the world of community organizing right here in Connecticut. Amid national and international conflicts, we'll ask what it means to build local support networks during times of need. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. In times of crisis, what do you do? Do you hunker down and prep for the worst, or do you go out and bond with your neighbors and community? Today, we'll hear from organizers who are working within their communities to build statewide support networks to fight for those who need it the most. Joining us first is Ra Carter. They're a founding member of Mutual Aid Hartford and are an experienced community organizer. Thank you so much for joining us today, Ra.
Hey, Catherine. Thanks for having me.
And for our listeners, let us know if you're organizing with your neighbors or if you wish you were. Love to hear from you. 888-720-9677. You can also find us online at Where We Live or send us an email, wherewelive@ctpublic.org. So, Ra, can you tell us first, what exactly is mutual aid?
Yeah. Mutual aid is maybe a newer term, but an older concept rooted in indigenous African practices of care of the collective, right? This idea of collectivism, that we are all well when each of us is well, right? Mm-hmm. That we can build more power, right, and durability as a group through taking care of each other.
And I feel like a lot of people seem to have the misconception that mutual aid is the same as charity. Can you clarify that for us? I know it's kind of like we're going into sort of definition territory, but I wonder if there's a difference.
Yeah. I think charity, the main differential for us at Mutual Aid Hartford is that charity requires that there continue to be a class and a group of people that do not have enough, and a class and a group of people that have more than enough. And mutual aid seeks to be an equalizer in that we all have needs here and we all have something to offer, and that we can redistribute resources and wealth in a way that is produces more safety and equity for people. And so charity is a function of capitalism, essentially, and mutual aid is a function of the people that says, what do you need? What do I have? Right? And shares in that exchange until we all have what we need.
And so can you tell us about the history of Mutual Aid Hartford? How did it get started and what does it look like today?
Yeah. So Mutual Aid Hartford actually started during the COVID-19 crisis. So it was very much a response to an emergency. It was founded by mothers, community members, community organizers, people who just felt a responsibility to Hartford, right, to this place, not along the lines of any saviorism, but just we're neighbors here. We're all here together. Let's do this thing together. We know Hartford, with its socioeconomic demographic, was going to be very hard hit, right, by the COVID-19 crisis. And so a group of us came together and simply started that list of needs and offers. And it started as a Facebook post, actually, and got turned into a Google form where we were asking, what do you need? What do you have to offer? And before we knew it, we had rapidly grassroots fundraised, and this is just from Hartford residents, tens of thousands of dollars. We were basically running all volunteer, no contact Instacart service of food, diapers, supplies. We had 3 distinct food distribution sites, and dozens of people rose to the occasion to take care of each other. And those that felt less at risk or had more to share took the riskier roles of like going out to shop, and those that needed to stay inside or were compromised, right, asked for what they needed. It was really beautiful.
Well, sometimes you cannot deny the power of social media, right? A Facebook post.
Absolutely.
A different sense of community, I think. And you mentioned this collectivism earlier, where I feel like, especially anecdotally, seeing what was happening around me at the time too, where a lot of people started to come together and build community, realizing there is such a need for it. And is that something, I mean, clearly that's something that you saw, but can you talk about more about how that really... I feel like a lot of people just realize that, I can't be alone in this situation. I have to be able to either help someone or ask for help, which is sometimes the hardest thing to do, right? Is that something that you have seen more? Are more people coming to help and wanting to be neighborly and wanting to help your neighbors since Mutual Aid Hartford was established?
You know, I think what we've seen is that people understand we don't have a choice, right? Mutual aid practice is actually very organic in places where there is not the idea of an endless supply of resource, right? Most people in many cultures have to practice organically this ethic around sharing, care, and caring, because there simply is not even the idea that we will all be able to individually have more and more and more and more. That's a very like American, very Western take. And so I think what's happened over the course of the last 6 years is many people's reality has been rocked. Everyone we know has been impacted politically, in our current political terrain, and also through the COVID-19 crisis in some way. And I think people are realizing that fallacy, that we can all just have more and more and more and build more and more and more individually. And so I do see this ethic where people are understanding redistribution, right? We see this, I've seen this rise in susus, right? And different resource sharing models. We see where people are understanding the connections between various issues and campaigns. And so where there was once really clear issue-based organizing, we're building coalition now. We're building across issues and identities. We understand that we need each other. We understand that our issues span race, class, and gender, and we're really united against a common enemy in many ways.
Well, and one thing that your organization highlights is education. And we're also having this conversation amidst many conflicts nationally, internationally, personally. How does education factor into your philosophies of mutual aid?
Yeah, thanks for asking that. Because we have an ethic of practicing mutual aid as organizing or within the organizing ecosystem, right? Our goal is to strengthen structure-based organizing through a practice of mutual aid, creating on-ramps for everyday people, meeting material needs, and mobilizing people towards campaigns and organizations that are working for human rights. But that does require that we build leadership, that we build political will, that we do political education with people, because the function of our conditions is that they don't leave much time and space for us to consider those things and practice this collective ethic, right? There's a lot of writing and conversation around the isolation and alienation of capitalism, right? And so we practice our education and learning and training spaces as another space for connectivity and to build relationship so that we can move each other towards political power building.
And is this a community of across the ages, across the generations? How are you seeing the different generations? Accept is probably not the best word for this, but just how do they go into this community building? Because I imagine different generations perhaps have different ideas of what that means.
Absolutely. We are currently really trying to work on this idea of intergenerational practice. We had a big fundraiser at the end of last year, and it was really beautiful. The ages spanned, 18 to 70, right, in the room. And that ethic is extremely important to us because we need the wisdom of our elders is essential, right, to keep moving us forward. And essentially, we're building the world for young people and children. And so their voice in the room is crucial because they are going to live in and lead, right, this new world that we're building. And so while it can be difficult to cultivate, we've found that actually that range blends very well in one space, and people really, really appreciate the invitation to be there and share in that together. And there's a natural coming together that happens, when everyone's simply invited into the room for their important role.
Well, I know you mentioned that Mutual Aid Hartford sort of happened by accident, and you were preparing for a crisis that really no one has a manual for, and a manual doesn't really exist when it comes to crisis preparation, really, in some ways. So what does it mean to you today to be able to prepare for a crisis, regardless of what that looks like, because you do have a network now versus back in that time, you did not have that?
Yeah, we've actually had a really beautiful example of that come together. As we moved Mutual Aid Hartford out of direct crisis response and really ideated over the last couple years and practiced mutual aid as organizing and connecting mutual aid work to structure-based organizing. When the EBT and SNAP crisis was hitting at the end of last year, the network that we have sustained rose to the occasion. And we started just getting a bunch of messages. Hey, what are we doing? Let me know what I can do, right? And so now there is a group of about 10 people and many more volunteers who have been running this community food program for several months now, and are looking to move it into more of a co-op buying club. And all of that is the result of the network that we built in 2020 through the birth of Mutual Aid Hartford. And so we have seen what we were saying would happen come true, is that if you build these networks, if you keep these relationships intact along these lines of justice and build this political will, the people will step up. And that's exactly what's happened.
Lots of networking, lots of having conversations and meeting people. I know there's a lot of people who probably would like to get involved, but they don't know how to. Do they pick up a phone? Do they join Facebook? What goes into, actually more like for those who are wanting to be involved, what's the easiest way for them to get in contact or to get connected?
Yeah, please go to our website, mutualaidhartford.com, become a member. It's a really simple application right on our website. You can see everything we're up to there. Membership is simple. We have several tiers that you can participate in. No requirements necessary to simply be somebody that comes to events. We'll set up a bit of a one-on-one with you, get to know you, figure out what you need and have to offer. We still function on that premise. And we'd love to have you. So mutualaidhartford.com.
Appreciate you for giving that information. You've been listening to Ra Carter. They're a founding member of Mutual Aid Hartford and a local community organizer. Ra, thank you so much for being with us today.
Thank you for having me.
And for our listeners, let us know if you're a community organizer. We would love to hear from you. Give us a call, 888-720-9677, or find us online at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. We've been talking about community organizing, and one of the fastest growing organizations here in Connecticut is Indivisible CT. They're part of the national grassroots movement empowering local communities to organize action. And we're now joined by the founder of Indivisible CT, Jim Chapdelaine. Jim, thank you so much for joining us today.
Thanks for having me. I should clarify that Indivisible CT is our local chapter formed in 2017 with 8 people before we knew there would be other chapters. So since October, there's another 35, 40 chapters in Connecticut. So we're not the kings of the state or anything.
Well, that's an amazing amount of growth, and we'll definitely get into how that came to be later on this segment. But we'd love to sort of start. I guess I kind of started with some definitions earlier with Ra Carter with Mutual Aid Hartford. They also mentioned the word grassroots. So, Jim, can you tell us what does it mean for a movement to be grassroots?
Well, technically, we would not be affiliated with a party, although we are clearly slanted towards preserving democracy or stabilizing a wobbly democracy. And through that, you can address, however clumsily, almost any social climate change, any sort of issue that we see people sort of committing to. Ours is one where we pick candidates we like, we canvass, we do a lot of stuff like that. We interface with politicians to a certain degree, but we also have organizations that come and partner with us, like the ACLU, for example. I will say it started with 8 people in my living room, and our Facebook site today had 9,500 people. So it is kind of a period of rapid growth, and that growth is a direct correlation to the circumstances that we find ourselves in.
Well, you started by telling us how big it has grown since it was established. But can you kind of take a step back, a little rewinding here? If you can tell us, how did Indivisible CT came to be in the first place?
I would say after the 2016 election, I took off a day to mope. I think moping Wednesday, and then I had to figure out what I was going to do. And I saw this pamphlet online like a month later. It took me 26 pages. And it seemed like something that I could do. I didn't have to paint my face. I didn't have to dress in camouflage. I could just go out and do the things in there. How to deal with your blue representatives, how to deal with your red representatives, carrot, stick, rallies, demonstrations, and of course, participating in elections.
And when that was established in your living room, I know it was hard to imagine that this was going to be your future today, where it has grown exponentially. But would love to also learn more about what exactly does Indivisible CT do. Can you give us some recent examples of what you have been working on?
Sure. We are one of the 3 leads in organizing all the No Kings rallies in Hartford. I personally go out and I visit a lot of new chapters because I like to see what's going on. So I'll go out to the Quiet Corner. I'll go out to North Central Connecticut and meet with people and give them some advice, not to tell them what to do, but tell them about the mistakes we made early on so they don't have to repeat those mistakes.
When earlier we also touched on how these organizations or these demonstrations or community organizing really is starting to see a lot of intergenerational members or intergenerational people who want to be involved. So is this something that you're seeing too, or give us an idea of what kinds of people participate in your activities?
Well, I have to say early on, it was our group could be stereotyped as old white hippies for a little while, but that's changed quite a bit, much more diverse. And if we don't have people in our group that are representative of where we live, I worked in a promo, then we go out and we find another group to work with. So we partner all the time. We expand our networks. We connect the dots on a map, and we try to be there when we're needed, regardless of the demographic or the problem.
And so while you're connecting the dots, and a lot of this, it seems very local. You're going within the state of Connecticut. You're going into all of the corners that you can. Why do you think it's important to focus on local action versus, say, potentially sending everyone down to D.C. to protest, or maybe just get involved in protests that may have more heads in it?
Well, I think this upcoming No Kings rally on 3/28, we've gone from 4,000 on the first one to 10,000 to 12,000. So I think we'll go to 15,000. I think it's getting the word out. It's having visibility like that. So I think all that stuff pushes growth and builds a sense of community. So, for example, the previous speaker, we could partner with them on something, and we would have the people power to amplify their message.
Well, and so you mentioned Mutual Aid Hartford, as we were talking earlier. That organization sort of came together because there was a need for connection. There's a need for community. Can you give us a sense of why people are participating in Indivisible CT? What have you been hearing from people as to why they're coming? Why are they involved?
Well, I vet every single profile that comes into our Facebook group, and all of them are highly dismayed and dysregulated over the state of government and the people that are in government. And we feel like the mechanism of an election coming up is going to help begin to stabilize that. So I think people come here to build community, to be part of a community. It's a time where you really want to feel like you're connected and that you belong to something. So we're constantly getting new ideas, whether it's having a visibility brigade over the highway or having a gripe session called Wine and Wine, where you can go and air your grievances. But we always have a tight agenda, and we always have short-term, long-term, midterm, long-term goal that we're. I think people like I guess to boil it down is action eats anxiety. And it's an anxious time we live in. So we try to provide action.
Well, and among the action is I think you know that there's also space for meetings to be fun or for people to be angry while organizing. I'm sure
I'm glad you brought that up.
There's a lot of different kinds of emotions when it comes to these conversations. Give us an idea of what does this look like at your meetings, and we hear that you're also doing potlucks.
Somebody ratted out that we've become our parents. I have to say I was potluck skeptical, and now I'm a fan. They're a great way to build community.
I was going to ask what changed your mind?
When we decided to have one, I went to it and I had a great time. It's a different way of bonding with people than sitting in a circle or sitting in a front-facing information receiving position. I will say, you mentioned fun. I think it's absolutely essential that we are whistling by the boneyard now and having some laughs. And it gets harder to do because the fluidity of our national circumstances changes almost by the hour, and the whole flood the zone thing. So when people feel overwhelmed, we'd just soon not have people come and cry, although they can if they want to. But we do like to have a little fun when we're doing this, so that when you leave a meeting, you want to come back. And I know every time I go to a meeting or an action, I feel better.
Well, I think the definition of fun can be very different for many people and different circumstances. And you mentioned, this is a space to air your grievances, to air your feelings. And I imagine that you're going to or have met people who are either cynical about your work, or maybe they're so overwhelmed that they lose hope of what can they possibly do to make a difference. So what do you say to those people who might find themselves in those spaces?
I would say, I came up with a little rule of thumb for that early on. This was in the first term, and I'd be walking, people say, don't you just, and they'd start blowing off about a certain someone. And after the third time, I realized, okay, what are you doing about it? You're not doing anything about it. So I'm revoking your license to chirp at me about that until you fill out these 100 postcards. So when they came back, then we restored the license so they could yell about it again. So I think getting people involved in actions and seeing the results of those actions, I think of today's a big day for primaries. We did see the results of groups like ours, not specifically ours, but ours in conjunction with all the other groups, generate enormous enthusiasm in the last election.
Well, in about 30 seconds, can you let us know what's your favorite thing about organizing?
Oh, wow. I would go with it. It just makes me feel better to do stuff and to grow our group.
And to have more potlucks, it seems.
You should come to the next one.
We'll appreciate the invitation.
You can report on it. You can just report on it.
Well, we appreciate the invitation. Thank you so much. You've been listening to Jim Chapdelaine, who's the founder of Indivisible CT. Jim, thank you so much for sharing your experience.
Thank you so much for having me.
Appreciate it. Thank you so much. I'm Catherine Shen. Today's show is produced by Isaac Moss, Tess Terrible, and Patrick Scahill. Our technical producer is Dylan Reyes. Download Where We Live anytime on your favorite podcast app. And as always, thank you all so much for listening.
I've always wanted to live in a neighborhood with you, so let's make the most of this beautiful day. Since we're together, we might as well say, would you be mine? Could you be mine? Won't you be my neighbor? Won't you please? Won't you please? Please won't you be my neighbor?